Hey pizza lovers, are you ready for an amazing opportunity that combines your love for pizza with the chance to win big? Click the link in the video description now and take our survey for your chance to enjoy free pizza for a year and a complimentary Visa gift card.
From rashes to lumps, odors to dryness, redness, itching, and more, there are many intimate health complaints that can affect women, and often the symptoms can be easy to confuse. Here's our definitive expert guide to getting the right diagnosis and treatment for these problems, and what you can do to prevent them coming back. It could be thrush. This is a fungal overgrowth that can affect the vagina and the surrounding skin. It's extremely common, and an estimated 75% of women will have thrush at least once. Symptoms include a thick, odorless, white, cottage cheese-like discharge, a burning or itching sensation around the vulva, and a sore and irritated vagina, particularly after sex, says Dr. Sakadanandamidi, a consultant gynecologist and obstetrician at Manchester University NHS Foundation Trust and the private Pall Mall Medical Clinics. It also causes painful sex or stinging when you pass urine, he says. It's not a sexually transmitted disease, although it can be passed to a partner. In men, it can affect the penis. What causes it? The main culprit is an overgrowth of Candida albicans, a fungal yeast which is found naturally in the vagina. An imbalance can be caused by taking antibiotics or the contraceptive pill, as well as stress and sex. Fluctuating levels of estrogen can also alter the vaginal pH, leading to vaginal thrush around the time of periods. How it's treated: thrush is treated with antifungals, says Dr. Mighty. These include pessary tablets that you insert into the vagina. Antifungal treatments can be bought from pharmacies without a prescription. These include Cane's 10 thrush treatment, £10 from most pharmacies, and fluconazole, £2 and 49 pence for 2 capsules, chemist-4-u.com. Your sexual partner doesn't need treatment unless they have symptoms, but it's a good idea that they use a condom until you are clear of thrush so you don't keep passing it back and forth between you, says Dr. Mighty. The infection will usually clear up within a few days, but if symptoms persist you should consult your doctor. They may also swab for a bacterial or viral infection. Guidelines from the National Institute for Health and Care Excellence, NICE, recommend recurrent thrush be treated with 3 doses of 150 mg oral fluconazole, an antifungal drug, followed by a maintenance dose of 150 mg once a week for 6 months. It could be bacterial vaginosis, BV. This is an infection caused by an imbalance in the community of bacteria that is naturally found in the vagina. According to the World Health Organization, BV affects between 23 to 29% of women of reproductive age at some point. Symptoms include a gray or white watery discharge, with a strong fishy odor. What causes it? Although it mainly affects sexually active women, it is not a sexually transmitted infection, says Dr. Rhiannon Bray, a consultant urogynecologist at Kingston Hospital NHS Foundation Trust and the private New Victoria Hospital in London. In the vagina there is a community of yeast and bacteria, collectively known as the vaginal microbiome. Just as the gut has its own microbiome, the vagina does, too. When a woman has BV, it's often because she has too many bacteria in the mix and less yeast. It can happen when we wash away the good microbes, with soap or using bubble bath, shampoo or shower gel in the bath, and feminine hygiene products which can allow the bad bacteria to take hold. BV can also occur when there's an overgrowth of pathogens and less of the friendly lactobacillus bacteria, which can occur as a result of sex, using strong detergents to wash your underwear and smoking. Women will get BV and worry about the fishy smell and wrongly believe they're not clean enough, says Dr. Bray. Then they start overwashing the vagina, but this can wash away all the good bacteria and make things worse. The vagina is self-cleansing and doesn't need washing or wiping with cleansing wipes. BV is diagnosed by taking a history of symptoms and a swab to rule out other causes, including sexually transmitted infections such as chlamydia. How it's treated: BV is mainly treated with antibiotics such as metronidazole, which comes as a tablet or vaginal gel, or clindamycin, which comes as a pill, suppository, or cream that is inserted into the vagina, says Dr. Bray. If you have a same-sex partner, she will also need to be treated. It doesn't spread too